All right, as we get people joining in, I would just like to say welcome everybody today to our panel discussion on community connectedness for increasing health equity. I'm very honored to be joined by our three panelists, Dr. Nada Fadul, Ashlei Spivey, and Callie Patterson. So very honored to have them here today, and I look forward to having you guys hear a little bit more about them here in a second.
Sorry to interrupt you. We also have Sadie Thompson joining us.
Oh, and Sadie, sorry. Sorry, Sadie, and Sadie Thompson. First off, just kind of why this topic of community connectedness for increasing health equity. And that really comes down to each of us has our own inherent value and skill and talents to improve the physical and psychological health and well-being of the members of the communities that we live and work in. And also, we're really looking to share and learn from each other's methods to improve care, health promotion, education, and research, and really just advocate for all voices and how we can better support, connect, collaborate, and cultivate our relationships and friendships and care for each other. So as you guys know, this year's theme is creating, or the theme of this year's conference is creating connections for healthier community. So that connectedness really refers to our interpersonal closeness, from the broader social world as individuals. And we're really looking at those feelings of caring, belonging, trust, value, and respect. And it really, that definition really encompasses the nature and quality of connections, both within and between multiple layers of social ecology and our relationships with our family members, our friends, community, institutions, and society. So our mission today as a panel is to explore the ways that community connections and connectedness build healthier communities in Nebraska. So again, I am joined first off by Sadie Thompson. Sadie, would you like to give a brief introduction?
Sure, thanks, Quinn. And thank you to all of you for inviting me to be a part of this panel. My name's Sadie Thompson. I'm the Chief Implementation Officer of Wellbeing Initiative and the author of the state and nationally certified peer support training manual. And my life is a lot around, has a lot to do with peer support, with supporting people and developing healthy and authentic relationships with one another, and the power that that can have in our healing, both physical, mental, emotional, and overall social healing that we get to obtain from, getting to know each other and letting down the barriers of labels and social barriers that we have inflicted upon us. So I am an author and an educator, but in large part, and also do a lot of advocacy at the both state and federal level through the National Council and NABHO. And just really excited to be here and get to talk about how we can further equity and the importance of it in regards to whole health, including mental health and substance use challenges.
Awesome, thanks, Sadie. Next up, Ashlei Spivey. I'd like to talk a little bit about yourself and your background.
Yes, well, thank you for having me, first of all, and hello to all the participants out there. I think we're at 104, so it's nice to be in space with each of you. I am Ashlei Spivey. My pronouns are she, her, and I am the director and founder for IB Black Girl. IB Black Girl is a collective that works on behalf of and with Black women, femmes, and girls to access and reach our full potential through a reproductive justice lens. So our work takes many forms, and we have a specific birth justice initiative. We're doing a lot of advocacy and economic liberation for Black women and femmes across the state of Nebraska. So I'm super excited to be here. I wear a lot of different hats in community, from working in philanthropy to entrepreneurship and economic development, to being a business owner. So I'm excited for this conversation, especially through the lens of justice and liberation.
Awesome. Thanks, Ashley. And then, and finally, our final panelist, Dr. Nada Fadul.
Yes, thank you so much for having me, and welcome everyone. I'm really looking forward to this conversation and hope that we all learn from each other during this conversation. So my name is Nada Fadul. I'm Assistant Dean of Diversity, Equity, Inclusion Education Programs at the University of Nebraska Medical Center, College of Medicine. I'm also an infectious disease faculty, so working very closely with people living with HIV and also people who have COVID-19. And my night job, or my other job, is that I'm involved with several community organizations, including the Greater Omaha Sudanese Community, the Association of Sudanese American Professors, and the Sudanese American Public Affairs Association, where I serve as vice chair. So I've been heavily involved with the community, especially during COVID-19, and really looking forward to this conversation.
Awesome. Thank you. And finally, I'm your moderator for today, Quinn Lewandowski. My day job is I work for the University of Nebraska Public Policy Center, primarily in behavioral health and suicide prevention at night or weekends or whatever you may call it. I am the current president of the Nebraska State Suicide Prevention Coalition. So happy to guide us through this discussion today. As far as our panel format today, we have 5 questions kind of lined up for our panelists today, and we'll kind of go through in rotating order and making sure that we're hearing each of their perspectives on each question, but leaving some room for some discussion along the way. First off, our first question is, and we'll start with Ashlei first. What does community mean to you, and what does being connected with one's community look like? I'll place that question in the chat as well. Sorry. Go ahead, Ashlei.
I think that's a great grounding question, and I think it could look very different for different types of folks. For me, in my work and how I show up, I lean into my identities and my lived experience. And so when I think about how I show up in spaces of being a Black woman that is from North Omaha, a Black woman that is a mother from North Omaha, right? Like all of these experiences and identities color what that looks like for me. And so my community is really connected to those. I think when we talk about community, it can also take different forms. So it's not just about where you live and where your house is located, but who is in your village, who are people that you go to for support, who do you meet with socially, right, and connect with from that instance. And I think it's really important to feel super connected. I know, what year is this? 2022. So maybe about 6 years now. I feel like with COVID, I can't keep track of time in the same way. But there was a survey done here in Omaha by the young professionals, the Urban League Young Professionals and the Chamber of Commerce. And it looked at what was the experience of Black young folks, Black professionals in the city. And what came out of that survey was something that we already knew, right? People just need more data sometimes, so that's fine. But it was really around not feeling this sense of connectedness to your community. And so the Black folks that took that survey talked about not having as many cultural experiences, not having as many amenities designed and intentionally curated for Black young folks. The difference of Omaha feeling really familial and like everything is for a family and a very traditional family versus for folks that maybe are single and have a different family structure. And so people were leaving. People were leaving the city, are still leaving the city. It's really hard to retain people from a talent perspective, from a community perspective. And so I think that's one example of how important thinking about how folks identify what does their community look like based on their definitions, and then how do they feel a sense of engagement, a sense of support, and truly connectedness to that, to that space.
Definitely. I saw that data, especially lots of young professionals just leaving the metro and heading somewhere. So that's fine. Nada, would you like to answer that next? What
Yeah,
is
sure. Yeah, so I think I'll follow on Ashleigh's answer. And I think to me also community means different things. I mean, traditionally it's a group that you have some common characteristics with, that you feel that you belong to. And just like many other people, I have all of these intersectionalities of my identities. I'm from Sudan, I'm a Muslim, I'm a Black woman, I wear hijab, I speak Arabic. So I have all these intersectional identities that help me fit into different communities. So all of these communities where I feel like I belong some way or the other. But I also have these communities where I feel the commitment to, that I feel like I have a commitment to belong or serve or help or act on behalf or advocate for. So an example of that is my patient population, people who live with HIV. I feel that's a community that I really need to stand up for and be their advocates. It's one of those marginalized, underserved communities. So even though I might not be part of that community, but I feel like I belong there because that's a space that gives me purpose and meaning. So I think in terms of what this community, it's such a broad definition, such a broad word, depends on where you belong or where you feel like you serve. Now, in terms of being connected to the community, I really believe in organic connections, connections that are not characterized by an outcome or a measure that you want to focus on this measure. And in that space, you really want the community to set the agenda. Like, what does that community really need from you? How can you fit into that community rather than coming with your own agenda? And in that space, I also feel like many times we look at the community as a place where people want us to serve rather than learn or be served even sometimes. And in that connection, you want to make sure that you celebrate the community's culture and successes and you feel their pain as well. That's really, to me, the real connectedness, not just an engagement here and there where you come in and leave on your own terms. So.
Awesome, thank you. Sadie, what does community mean to you?
Yeah, thank you. I will also piggyback off of Ashlei and Nada, that in general, the world I come from in peer support, we work out of our own lived experience and believe that we are only experts really on ourselves. No one else can be an expert on us. And I think that when I think about what community means, it's where is my home? And so my home could be like a virtual platform where I have people that I feel connected to. My home could be my family, that when we're all under one roof together, I feel fulfilled and safe and whole. My home could also be the city that I live in, or the set of things I've overcome in my life. Because I think that when I talk about mental health and substance use specifically, so much of the recovery process is about finding a home that is a place where you can continue to sustain some type of recovery. And so always that involves other people, but it also involves environmental factors and my personal set of lived experiences. You know, when I connect with folks who also have experienced childhood trauma or have, you know, severe and persistent mental health condition like I do, or recovering from a substance use disorder like I am, we have a common home that doesn't really need to be described. It's just, we both know that we belong in that home. And so I think of kind of I guess an esoteric version of the word home when I think of what community is and what it means to be connected.
Thank you, Sadie. Our next question, and we'll start with you first, Nada. What barriers to engagement and community connectedness do you think marginalized people experience here in Nebraska?
Yeah, that's a great question. And I'm going to give a boring answer to this, unfortunately, because it's really the same answer that comes to when it comes to health equity, health disparities, and all of that. It's the social determinants of health. It's the fact that these communities, the marginalized, minoritized communities, are trying to survive, and they're trying to just, and they're facing so many barriers in their daily lives. So when it comes to connecting with them, I think we really need to think about how do we meet them where they're at. And by that, I mean the literal form of that, and also just the emotional and other forms of that. So I think without addressing these systemic barriers, systemic racism, the social determinants of health, it's really going to be hard to make meaningful connections with these communities that will lead to some substantial outcomes in the future. So for example, if you're trying to connect with a community, let's say for a vaccine clinic, or trying to advocate for some sort of preventive measures, if you're not making it easy for them to have that connection and make them dictate where that connection is going to happen and how is it going to happen and when is it going to happen, it's going to be really hard to achieve that connection. And we've seen that those types of engagements fail one after the other because we're not really addressing the big elephant in the room. So I think it's so important to look at what are the issues, you know, what are the issues in the community's words, not in our own way of thinking. But is it transportation? Is it food? You know, if you're going to try to connect with them during hours where they're supposed to be working and making a living, is that really the ideal time to meet with them and make that connection? And what type of connection is going to work? You know, if you're trying to connect virtually with people who don't have internet access, is that really the way to connect? So I think, to me, in my world at least, I found those to be the biggest barriers to connection. Is those social determinants of health that prevents them from accessing so many other opportunities, whether it's education, healthcare, etc.
Awesome, thank you. Sadie?
Yeah, thank you. I think I totally agree with what Nada was talking about, and that's, I mean, at the crux of it, those are our barriers, that we have societal norms and systematic oppression that has created these barriers in the first place. So from a large view, you know, systematic oppression is the barrier to engagement. I do think bringing some attention, we could bring some attention to the fact that certain voices have never been lifted into our conversations, and there's a lack of trust for many groups of people because of historical trauma. And so acknowledging those things outright and beginning to create space that actually invites folks to share their perspective and gives time to share that perspective also. there's kind of this colonized idea of like, you have 3 days to respond to this focus group email or whatever. And that is not how everyone functions. And thinking about time in a super linear and like urgent fashion does not only creates more barriers for people who are like the doctor said, surviving. There's not a whole lot of extra time in the next 3 days for me to respond thoughtfully about these focus group questions. So maybe create some space to actually allow that conversation to happen. So I think I kind of went into some solution because I'm very much solution and strengths focused, but I think that's probably I think some of our biggest barriers is recognizing that we don't actually create space for voices and a platform for voices to be lifted.
Thanks, Sadie. And we're getting some good audience feedback. I'll touch on that in a little bit. But Ashlei, I would love to hear your answer next.
Yeah, I would totally agree with Dr. Nada and Sadie on their comments as well. I think for me, and based in the role that I sit in with IB Black Girl and just my role in general of working in spaces of Black liberation, I do think from a macro level, it's all the isms, right? The institutional racism, patriarchy, anti-Blackness, right? Like those exist. I think we also have to start being accountable to how individuals perpetuate that harm and what we see on a day-to-day basis. And this is not necessarily a popular opinion, but I'm gonna say it because this panel is supposed to push us, right, and have real conversations. But when I think about the work of IB Black Girl and us doing our Black birth justice work, right? So I think that really resonates with the folks that are on this call and the type of work that people are doing. We have created a space that is built on principles of anti-racism, womanist frameworks. And so the space that we've built doesn't have those same type of barriers that we're talking about, right? Because that space was intentionally created for and by Black women, femmes, and girls. And what we had to reconcile is when we have built our organization on those frameworks, we also have to have an abolitionist approach. And when we work with our partners in the medical field or adjacent fields, we say very explicitly and unapologetically that these systems were not built for us, never were, are not serving us, and won't. Period. And so as much as we are in these systems working to transform, reimagine, we really have to reconcile that of it may not ever be that. And so how do we dismantle and reimagine something outside of the system that again was built for us, by us, with our intentions, and us being centered in that space. And so I think, you know, there's, depending on what role you sit in, what type of work you're doing, and I know folks are naming it in the chat, you can see items that may be barriers, right? But I think we have to really just, I think, Dr. Nada, you said that, like, say the elephant in the room of like, this system was not built to serve Black folks. This system was not built to serve brown folks. And so that in itself is a barrier. So how do you work within that, name that, and then again, try to center what that person and that person you're serving needs and wants in order to actualize whatever it is that they're doing. And I think that's a tension that we consistently hold and that we consistently wrestle with doing our work.
Awesome. Thanks, Ashlei. And yeah, some great comments from the audience as well, mentioning the language barrier, healthcare mistrust, transportation, lack of insurance or money, time, having to deal around hours of work, lack of trust, childcare, and just general understanding of cultural differences. And that dovetails kind of nicely into our third question. Sadie, we'll have you answer this first. What do you think are the most sound and respectful approaches to gaining engagement and trust diverse communities?
Yeah. Well, I think we not only have to ask for what any particular group or community member might need to feel engaged in a process or to even begin to open the door to trust. We have to take those comments seriously. And I think that that is something that we get hung up on a lot, especially in the medical and behavioral health care fields. There's kind of this concept of always looking at a deficit and treating from a space of pathologizing people and looking at deficits in order to fix them. And what we know, I mean, I'm sure a lot of us on this panel here feel that the things that are different about us are not things that are wrong with us. They're things that are different about us. And so really having person-led services. And I mean, a focus group that carries through where participants of that focus group are actual like partners in the development of something, to me is the most respectful way that we can approach that kind of work. And that sounds really simple, but I know so many people that are hoping to do work around diversity and inclusiveness. And I get invited to the table, talk about, the place where I'm coming from with my own lived experiences and what would actually reach me during some of my hardest times. And now, because, it's not like a veil was pulled back up over my eyes after I had all those lived experiences. I still am untrusting of a lot of systems, and bring me to a table, listen to what I have to say, and then do that, which is very challenging to folks that traditionally have power. I keep moving into that next question on accident. Those were very well curated questions, by the way. But, and saying, you know what, your ideas are awesome. They're within the framework that hasn't served this community for centuries. So set those aside, and we're going to use try these new ideas that aren't yours. That's really difficult, I think, for some leaders to take a deep breath and say, I'm just here facilitating the improvement of a system by the community for the community. So that's where I sit on that.
Awesome. Thanks, Sadie. And thank you so much, audience participation. We're reading these as we go along, and I'm sure we'll have some reaction, and especially inclusion in our conversation as we go along. So keep it up. Next, Ashlei, your answer to that.
Yes, can you repeat the question? My chat box isn't working, so I can't
No
read
problem.
all of the comments or the questions for some reason.
Yeah. What do you think are the most sound and respectful approaches to gaining engagement and trust to diverse communities?
Okay, so my first question back is like, what do we mean by diverse communities? I feel like language is important, and the intention that we use language is really important. And I feel like diverse communities, DEI has become this very sexy, taboo space that people have like FOMO if they're not doing it. And it really negates the work that happens around like justice and liberation. And so when we say diverse communities, what are we talking about? What identities, what experiences, what are we prioritizing or not like, and how do those intersect? And I think being really clear about that, because that's going to really determine what types of approaches that you curate, what types of folks that you bring to help curate those solutions or ideas. And so that would be a question back that I ask as folks are thinking about that. You know, for us, when we, again, thinking about our work with IB Black Girl, it is Black women and femmes doing the work on behalf of Black women and femmes, right? And so when we think about that, we're not a monolith. So we have the gradients of all of our experiences that we try to represent in our leadership, in our board, and our programming. That really makes a difference of how we engage and what does that look like. I think depending on how you're trying to engage, I know a lot of folks have talked about like focus groups or getting that feedback. I think one opportunity is to really compensate the people that are experts, and it's not you. It's not you holding the focus group, it's the people that are attending the focus group. And so how do you recognize that folks are experts on their experiences? We may use different language, we may have different ways of articulating our thoughts and ideas, but the people that are most impacted and closest to the work that you're doing are the experts, and we need to compensate them and treat them as such, like we do our colleagues in the professionalized space, right? So I think that is an opportunity for us. We have done that. We released some research called The Essence of Us, and it is on our website. And as we thought about like, how do we approach this work? Like, yes, we're Black women, femmes and girls doing this work at every level of the org, but we also live in the same systems that perpetuate harm and that are embedded with white supremacy culture. And so we can absolutely perpetuate harm if we do not critically reflect on ourselves and decolonize our approach and thoughts. And so as we were building what we were doing, we said, okay, we have our ideas, but we want to make sure we're bringing in voice of community, again, because we're not a monolith. And so we commissioned this research that looked at like existing research that was already out there and what it said about what, you know, kind of the state of Black women and girls. There's no data on femmes. And then we held listening sessions where we went around and were intentional. Okay, like let's really focus and create space for Black trans women. We want to make sure it's safe from an identity perspective because we know Black trans women are being killed in our streets. And so let's create an intentional space to talk about what that experience looks like and how we can bring that into IB Black Girl in a way that honors and uplifts what this particular part of our community is saying. We did it for Black young people, Black elders, like, right, like we had all of these different segments and other intersecting identities to being a Black woman, femme, or girl, to really help us color in our perspectives, check our blind spots and say, okay, what does this look like and what can we be committed to? And if we can't be committed to some of the feedback or solutions that were curated, how do we communicate that and honor people's time still in leadership and expertise? And so, again, I don't think that there is like a roadmap of like, if you do this, you'll do this, and then you'll reach the population, right? I think it's very nuanced, it's very complex. It depends on what you're working on. But for us, that has been the way in which we've approached this type of work.
Nada?
Yeah, I'm actually going to piggyback on what Ashlei and Sadie said. And with her last comment, especially about there is no custom made, or sorry, like one size that fits all. I mean, it has to really be kind of customized to that specific community and individualized to them. And I think when we approach a community, it has to be very clear that we're not trying to advance our own agenda or our own gains. And that's really the only way we can gain the trust, especially of the stakeholders of the community, the people who trust us the least. And I'm speaking about the medical community in this sentence, is that because we do know that there is medical mistrust from the community, and there are reasons why they mistrust the medical system. There is a lot of precedents of how they were mistreated and mismanaged by the medical system that led to that mistrust. So if you come to this from a place of, I'm not really gaining anything, if the community feels like you're genuinely interested in their well-being, I think you'll be able to gain that trust. And do not avoid the ones who mistrust you and go around them, because eventually you're going to have to face them. I think those should be the first ones you approach and try to bring them as partners into that conversation and be just a good listener and learn from the history. What have they encountered in the prior history that led them to this point of being mistrustful of the medical care system? And as I mentioned earlier, I really believe in organic connections, things that you don't have to have a timeline of when this has to happen. Just let it happen when the right moment is there. And I use this story many times of how I got really engaged with some of the Sudanese communities that I was trying really hard to reach in the past. And it actually happened early in the COVID pandemic, maybe around March 2020. We have a WhatsApp group of the Sudanese American Public Affairs Association. There are about 200 members from all parts of the country in that group. And I kept getting all these private messages about what's COVID, what's happening, should I be scared of this, etc. And I decided just to send the voice message in the group, just explaining what I know about this and the fact that we still don't know, and that there is a lot of misinformation out there and people should be very careful, and explain the routes of transmission, how to prevent yourself, etc. And before I know it, that message went viral. And it was sent to me by other people asking if this was me, because it got to them in all kinds of places. And that was really the way to build these connections, because people were looking for somebody that they can trust, that looks like them, that represents them, that speak the same language, that has come from the same background. So I think representation in this case makes a huge difference. And even with that representation, I'm still privileged. I'm a physician, I'm in a place of privilege. So I have to practice some cultural humility and not assume that people want this or need this, or this is the way they think or practice. So I with different communities, especially, I have to come from that place of cultural humility. I'm willing to learn, I'm vulnerable in this space. And it's okay to be wrong. It's okay to make mistakes, as long as you acknowledge that you're there to learn. And as long as you take that feedback to heart and make something out of it. So I know I'm going in circles, but I think it all comes to empathy and cultural humility, and not acting like you're the savior. I think I heard this yesterday and I loved it. Like, many times we come to these spaces, especially as physicians or healthcare practitioners, thinking that we're the saviors, we're here to help, or we're here to, help you in some way or the other. But many times we're not. We need to just be allies of these communities, and we need to empower them, to give them that space to rise, because we're not there many times when they need us. And unfortunately, the reality of the system is that it's not allowing for that to happen, where the community has this easy access to the people that they need. And that obviously needs to change at some point. But the message here is to try to empower those communities and give them the tools that they need. So back to you.
Awesome. And this brought up something, and we'll have, multiple people, turn off their computers today and go back to their job tomorrow, and that are working to serve their community. And there might be certain aspects of their work groups or how they serve that maybe they feel like they aren't inclusive of the community that they serve. What are some steps that they can do to better serve their communities and get those voices heard? I know we talked about compensation for some of that, but are there other ways that people, say in rural Nebraska, that are maybe missing a portion of their community that they serve? How can they get that engagement and feedback to better improve health equity and how they serve their populations? Any reaction?
I think for us, it's being in community with people, right? You can't be afraid to get out of your office or to get out of your traditional mode of how you contact, how you connect, or how you do your work. You really have to meet people where they are. And so if that means you have to advocate for a budget that allows you to travel, if you have to pick up the phone, and again, ask people permission of, hey, this is my intention, this is what I would like to do. Are you willing to provide that insight? Are you willing to help do that work with me? One, you have to be prepared to say no, because it's not their responsibility to figure it out for you. So be okay with that as well. And if they say yes, then again, how do you honor a structure that compensates people for their time, and I'm a fan of money, so yes, money, but also like, don't keep me somewhere for 4 hours and then have like a subpar childcare, you know, a salad bar for dinner, like, right, all of these things. Like, you want it to feel special. People want to feel respected and honored in a way that matters. And so like, you have to really think about every step of that process and what you're doing. And again, there's not a specific roadmap. And so I think you also have to be okay with it being messy, you not getting it right the first time or a couple times, that you're figuring out that it's iterative, right? Like, it's going to keep evolving, because the work that we're doing from a core root perspective is iterative, right? Like, these issues and opportunities are not staying the same because they're embedded in our systems. They are always changing, always evolving, and showing up differently. And so that means our work and our approach will do the same. And so I think really pushing yourself around what does your approach look like in the way in which you connect will be key in that. And then make sure you budget your capacity to do that additional work. And if you can't, what are other partners that can help us do that? Like, I've been like trying to scroll through, people are on here, and like, we have Christian Mentor, who is one of our advisory board members, but works at March of Dimes. She's a great partner for us in this. We have some folks from HHS like Shirley on here, and Kathy, who we partner with, right? Like, we can't hold it and do it all. And that's silly to think that we can when we're talking about such complex, nuanced issues. And so who are key partners that can help you do some of that work together, and what it looks like? And if okay on time, can I just give one example of that, of what I think has made a difference? So we held a town hall with the Maternal Mortality Review Committee and the PRAM survey around like, what does this data mean? Again, data is not accessible for everyone. What are the true implications? What are opportunities and recommendations? And the piece that came out of that town hall is that Black birthing people and women are not represented in the response in the PRAM survey. So there's not even true data to talk about what our experiences are, because we know our mortality rates are low, but we still have these near death and like not high quality care experiences in with the medical field. And so out of that town hall came an opportunity where now we have a meeting scheduled to say, okay, these organizations that are serving Black birthing people are going to support the outreach and connection, because they have, right, the relationships with the Black community to be able to get the information and help with the surveys, so that we can be represented in the data for folks that use the data to make decisions, if that data influences policy or other service providers, right? And so we don't expect HHS to be able to hold that, but our community partners can absolutely support and do that. And then now, again, it has those ripples effects. And so I think that is a great example of what that partnership could look like, and still honor people that are doing the work in the way in which Black birthing people want to connect into giving their feedback.
Yeah, and if I may add here, I think Ashlei stated it really beautifully. And I think if you're genuine, if you're really interested in engaging the community and being connected to the community, you'll find a way, because it comes down to you knowing that community and knowing what works for them and what doesn't work for them. And that's the value of listening and, you know, being sincere and genuine about your interest in getting connected with that community. I mean, it will come at a cost, whether that cost is your time, your energy, financial cost, providing meals, but it has to be customized to that community. So I think we really need to acknowledge that this is not going to be easy. You know, there is a lot of mistrust, there is a lot of barriers, there is so many other factors that play into this. So, but perseverance and persistence are key factors. I mean, it took me years to be able to engage with the community in a meaningful way where I can feel like I'm actually making a difference. And through this pandemic, I mean, I had probably like over 20 or 30 webinars with different communities around the country, Sudanese communities and other Arabic speaking communities that I would not have been able to reach if it wasn't for that persistence and perseverance and really wanting to get engaged and give back. I totally agree with Ashlei about compensation. It has to be, you're in your budget and you have to make time and effort for it. And, you know, we have a great advocate in our HIV clinic who has been really going out of her way to engage a consumer group with the clinic and get their feedback on our services and how can we serve them better. But they were holding these meetings at 6 p.m. on, a Friday or something. And it was a far location that it took time and effort for these community members to make it there. So over the years, the numbers were going down, and we only ended up with a couple of community members who were showing up. So she came to me and said, we really need to do something different. Can we provide meals for them? Can we give them compensation for this? And we had to figure it out. We went out of our way to figure out how we can come up with funding for this, but it's having that intention and being sincere about it that will help you eventually overcome those barriers.
Thank you. All right. Moving to our next question, question 4, and Ashlei, we'll go to you first. One aspect of engagement may be convincing traditional power holders and policy makers to yield and share power with groups that have been traditionally marginalized. What do you think the ideal power sharing looks like in community work?
Now, Quinn, I don't even know if we have enough time for this question. You should have led with this. People should have got some drinks out and snacks, because this is the question, right? And I think it's such a great question, because again, to me, based on our work, our values, right, how we show up, it's really about how folks wield, share, and build power. And for us, we look at power really being the ability to influence, access to resources, being able to make decisions, having that autonomy. And so I think that there are old power structure models, which we see, especially in like our state. I'm located in Omaha, and so there is a very clear power structure of who makes decisions, who has the resources to make those decisions, and how they continuously are able to build those resources off the backs of community, right? And then there's some new structure models that looks at how can these institutional power structures or people, right, inside of these institutions or as individuals really think about how they show up differently. And so for us and what we name, that's really about how can people use their power and influence to create space and opportunity. So how can you, instead of you deciding this is the intervention and you give money to it, say like, you know what you're doing and you're the expert, here is the money to do that and we're gonna let you do your thing. Or I have social capital to all of these folks that have influence and policy, I'm going to introduce you and not gatekeep that relationship. So now you have access in a different sphere of influence. I think the hard part is in the geography that we're located in, and from my experience, people are not willing to give up power, right? They feel like they're losing something, and it's a zero-sum game if they are. And I think we really have to examine that of why do you feel like you're losing something when now the space becomes more equitable, or there's more voices that are able to help influence and make that decision. You are, and we saw this, right, especially in this last legislative session, we are an organization that fights for reproductive access and justice, and the amount of legislation that came in by folks that did not have reproductive systems, that were making decisions based on people with reproductive systems, right? And were in these power positions, made a difference. And to the earlier question, as folks wanted to engage and advocate and change the power dynamics, you can't attend a legislative session because it's during the workday and you don't have a job that lets you off. It's 45 minutes away. You might not have the gas because gas is sky high now and you need to save and budget for something differently, right? Like it's all of these things that create barriers to how you truly change that system. And I don't know if that's going to change in our lifetime. Honestly, I think our work is really around chipping away at that and creating new opportunities. Like, I don't have to sit at your table, I'm gonna make my own table. And we're gonna have our own space that's rooted in community and connectedness, that's rooted around how we have a collective model of decision-making and how we share resources, right? Like really abolishing those thoughts, that approach, and reimagining something different that honors the needs, the values, and agreements of that community that is traditionally marginalized out of that space. And so I think, managing power and what it looks like here, especially as we talk about some like key areas of medical support, wages, transportation, it's really complex, and like we can talk about it all day, which is my fave. So if we keep talking about it for the rest of the time, I'm definitely here for it.
So thanks, Ashley. Nada?
Yeah, I mean, this is the $1 million question, right? I don't know if honestly, if I have an answer that's, it's going to make a change, like Ashley said, in our lifetime. But I think it's sad that we have to ask this question, but it's a reality, right? And the fact that there are certain things that make a difference in policy making that we can't ignore, which are money, savings. We know that there are several studies in the medical literature that show that promoting equity and addressing health disparities actually saves money, as opposed to what the opposite is. If states that had Medicaid expansion did much better in terms of healthcare outcomes, then that means healthcare savings. For example, in our world, we deal with people who contract HIV and hepatitis C through injection drug use, right? And I'm sure Sadie can relate to this, that, syringe exchange programs in other states, in other places, even safe spaces for injection use, have shown to improve outcomes and have shown to reduce healthcare cost, because treating one patient with hepatitis C can cost you $100,000. Treating someone with HIV lifelong can cost you millions of dollars. But if you prevent that through making community interventions that are meaningful and listening to these communities and providing them the resources, that will pay off in the long term. So sometimes you just have to talk the language that they understand, which in this case is going to be money, unfortunately. And then the other thing that I'm going to say is representation matters. I think all of us have a duty to put our voices on those places that make power, right? So promote those who are rising to become in places of power. Find your community members and empower them to run up for these seats, to become part of that table that we have to convince. So in this space, I think we really need to push for it, and it might not be in the next 10 years, but it has to come in the future, where these marginalized communities are sitting on the table making some of these decisions on behalf of their communities.
Excellent. Sadie?
Yes, thank you. And Nada, you are absolutely right. It can be frustrating when we talk about harm reduction methods and kind of where our state specifically sits on that, because there's so much evidence around the benefit and the fiscal responsibility associated with harm reduction and all of that. But I think that I know this is probably cliche, but I do live in a world of hope, and I live in a world of possibility. I try not to live in a world of limitation, because everything I've been told I couldn't do or wouldn't do or wasn't going to be able to overcome, I have. And I see that happen with other people also. Now, societally, I don't know if we are going to see it in our lifetime, where power holders and policymakers are willing to share power. But I did just have, and I'm kind of bringing it personal, but for me, when you're passionate about something, personal, professional, it all kind of comes together. And so my husband and I had a conversation probably 2 weeks ago about this. So I am a woman with a physical and a mental health disability, with a in recovery for substance use disorder. I've nearly died multiple times. My brother is a Black gay man. My sibling is a trans non-binary person living in Nebraska. I am surrounded by and filled with things that have altered the way that I view the world from a very an extremely, I guess, marginalized perspective, if that makes sense. Like just being, untrusting of medical systems and, having been over medicated for mental health and having been had maltreatment by medical doctors for physical health concerns. And I think money, it's going to come down to money or an upheaval and a revival of our entire, like a renaissance, which I'm not sure we're going to end up there. And I'm also a member of the LGBTQ community. So I'm like, and he's like a cis white male, right? And he's like, well, people like, you speak up, everybody else should just speak up, and he is very open-minded. Okay. And so honey, that is great. When a question gets posed to a group full of white men and I'm in the room, everyone else gets to answer. And then if there's time, I get to answer. If I speak up loud enough and I answer, it is not then reinforced and nobody's going, oh yeah, what Sadie said, for sure. They're then waiting till I finish so that they can say what they're going to say. And sometimes even somehow make what I said into their own ideas or explain what I was saying to the rest of the group. And that is, and so the power sharing, even in just personal interactions, is, I think, something that we don't see. Like our white patriarchal society doesn't see it. And we have to see it, we have to acknowledge it, and then we have to create space and say, you know what, for the last hundreds of years, I've been able to speak at all of these types of meetings. I think today I will sit back and just take notes. And he said, well, that's not fair. Then I don't get to say what I want to say. And I said, yes, honey, but we haven't been able to say what we want to say ever. So it wouldn't do you much harm to sit back and allow us to speak and say what we have to say. Nobody is infringing upon your personal power, or nobody's saying you have to think what I have to think. But I think it's all about creating space for those voices to be heard without having to be replicated or then explained by someone else who's a power holder, if that makes sense. And it will save everyone money. And I'm like, think about it, honey. What if we were like, we're all in the car, our kids, whatever, someone comes up with a gun. What's your role? What's my role? You have 100% the weight of our entire family on your shoulders, right? You have to be the protector. You have to do something about it. You're responsible for all of us. I said, what if you took away all these societal ideas of who you had to be because of your role in our family, and recognize that, like, you have a partner sitting next to you who's also, been around the block a couple times and could probably be helpful in that kind of situation. Those are like the societal weight, I think, is something that we need to talk about too. If everyone could recognize that certain groups are also carrying societal weight because of the grasping to power. And that's infringing upon their own health and well-being. That's like another huge element. Like, you can let some of that go and be healthier, share some of the load. You're not only in power, you're also carrying the load personally, which is, leading to a whole host of other societal issues. So that was a lot out of me, but I'm really passionate about this topic. And I think it's really important that those of us who have been in power can acknowledge that and step back and create time and space for voices that have not.
Thank you so much for sharing your story there, Sadie. And gosh, guys, I'm really blessed with this panel today. And heading into our fifth and final question before we open it up to some potential audience questions. Nada, we'll start with you first. How do you describe the value of inclusion and connectedness in community work?
Yeah, I'm gonna make this quick. And I think in my mind, this is probably the fastest route to reaching health equity. I think without including the community and being connected with the community, all the plans that we make are meaningless, and they're basically gonna sit on a paper somewhere and never really make its way to being implemented or making an impact. So if we're truly trying to make a difference in reaching health equity, the community has to be part of that. And as I mentioned earlier, we should stop looking at the community as people that we're trying to help, or we're the savior of that community, but rather is a partner in these solutions, because at the end, the solutions will help everyone, including the medical system, including policymakers, including the community. So they should be on the table drafting this agenda, making recommendations along with everyone else. And I think the other value that this brings is empathy. We often don't think about that, but empathy for the healthcare system from the community and vice versa, which is more important, is empathy for the community and their lived experiences and their challenges. So that connection with the community helps us understand where they're standing and what challenges they're facing, and being able to empathize with them. And I really think community connectedness should be part of medical education, of all health professional education. If we're trying to reach meaningful differences, we need to be there with the community on the ground to understand how things happen in their environment. You can't give somebody a prescription and expect them to just go and fill it and take it. You have to understand what the barriers that they face to get to that point. If they're struggling with just getting food on the table, that prescription is the last thing on their mind. So, and without being in the community and feeling those challenges and celebrating their successes and their culture, you'll never be able to understand this. Thank you.
Sadie, how do you describe the value of inclusion and connectedness in community work?
I think it's the final frontier, and it's the missing element of healthcare. And it's why I'm in the field I'm in, why I believe in peer support, having specific people that are paid to engage with your patients, clients, community, and be an advocate in your boardroom, as well as a chauffeur even to these resources that the community has at its disposal for participants in programming. Developing healthy.
Here's what I found.
Siri had something to say about that. Developing natural support systems and connections to community resources is not something that we can expect people to do on their own. And investing in peers to support patients and participants in accessing those resources from a lived experience, trusting space is I think the next frontier in medicine.
Thanks, Sadie. Ashlei, how do you describe the value of inclusion and connectedness in community work?
For me, I think inclusion is the footstool to really be rooted in justice and liberation. And so I know folks are at different journeys, right, as we talk about this type of work. And some folks are trying to wrap their arms around what does intentional diversity look like? What does inclusion look like, right? And I want to challenge this group to really think about justice and liberation. And what does that mean for connectedness and community? Again, when I think being rooted in our work and I think about our work, sometimes the community is not for you. And you have to be okay with that. This is not a space for you to be in. It's not a space that's curated for you. But what does it mean to support from afar? What does it mean to honor the agreements of that community? How do you ask permission to engage and connect? And so again, I think it's really nuanced, but I think for us and what I have seen that our roadmap and what we lean into is around justice and liberation for our communities, whether we're talking about reproductive access, Black birth justice work, whether we're talking about policy, like whatever we're doing, we are grounded in that this is really around the frameworks of justice and liberation. So how does that show up for us as people with lived experience and identities navigating the work, and then as well as the people that we are working alongside, which is the gradients of other Black women, femmes, and girls. And so I really want to challenge people to think about how do they show up in the work? What is the value set that is your agreement in how you do this work? Is there dissonance in how you have that value set versus how it operationalizes in your behavior and approach? And then how does that marry to what the community is saying that they want, need, and deserve?